right, hello everybody. It's Dr. Alex Earle here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earle. And this is the time I get to spend with you guys and answer all your questions and go over plastic surgery topics. And today we are kicking it old school. That's right. So last Wednesday I talked a little bit too much, so we didn't leave a lot of time for questions there. So today it's going to be pretty much a Q&A session, right? We're going to kick it old school. So I don't have really a presentation to get us jump started here today. So I am happy to take all your questions. We can talk about plastic surgery, of course, anything from head to toe. So, whether it's breast surgery, tummy tuck, liposuction, fat transfer, or anything like that. We can also talk about, head and neck. So if you want to have some questions regarding blepharoplasty, facelift, neck lift, rhinoplasty, we can talk about that as well, okay? And we can talk about the procedures, pre-op, post-op, pretty much anything related to the surgery, okay? So let's just go ahead and kick it off, all right?
Okay, I'm ready.
Right,
you don't want to sit, Doc?
No sitting today.
Okay.
It's going to be tossing my breast implant around as we do this as well.
Okay, the first one says, how long do you recommend your patients not sit on their booty after a BBL?
So how long not to sit? So no direct sitting for at least 6 weeks, okay? So does that mean you can't sit at all? No, it means that you can't sit directly on the booty, and you shouldn't put pressure on the hips for the first 6 weeks. In terms of sleeping, you're gonna be sleeping mostly face down. And if you do need to sit during that period of time, then we recommend that you use a special pillow called the BBL pillow. So sometimes there's a Bobby pillow out there that works okay as well. So Bobby pillow or BBL pillow is what you're gonna need within those first 6 weeks. And it is important that you have it because you're gonna need it, for our out-of-town patients, you're gonna need it on the flight home. Okay, so very important to have that with you.
What is the good fat? How do we get it?
The good fat, that's a good question. So there's no way that I can really tell like what's gonna be a better fat or less, not as good fat and things like that. So that's what makes the kind of BBL surgery or fat transfer surgery one where you can't be like so consistent every time, because you never really know, what's the quality of the fat that I'm gonna get, right? And then a whole bunch of other factors, right? Like what's the quality of the skin? How does the patient behave post-op? Are they feeding the fat? There's all these factors that are outside the surgeon's control for this particular surgery, which makes it, a little bit more difficult for it to be like completely predictable, like say, as opposed to say, for example, a breast augmentation, okay? Now, what can I recommend? Well, first of all, of course, we want to have enough fat to work with, right? So if you're on a lower BMI side, say your BMI is lower than 21, then I will ask you to gain weight, okay? Because I need more fat to work with. So we're gonna have to get you to at least, I don't do a BBL anyone with a BMI lower than 21. And 21 is still a little bit low. Ideally, we could get that up to about 23 or so.
Okay, now we're going to TikTok. We're receiving some questions.
Awesome, questions on the TikTok.
Yeah,
right.
Can you do a BBL and a mommy makeover with breast augmentation together?
Right, so I don't recommend that combination, okay? Now I know you're gonna say, well, Dr. X and X so-and-so does it, blah, blah, blah. I get it, okay. Here, let me just tell you why I don't recommend combining all those procedures at the same time. Some of the reasons have to do with specifically being in South Florida, and some of them are just more globally. So, what is it about South Florida? Well, in South Florida, when you're doing a procedure such as a tummy tuck or even the breast augmentation, you are then limited by the state, basically by the Florida Department of Health and the Florida legislature, to being able to remove only 1,000 cc's of fat via liposuction. For most patients, 1,000 cc's is not going to be enough to really be able to do a lipo 360. And then if you only have 1,000 cc's, that means you can only transfer 500 cc's per side for the BBL. Therefore, you're going to not get the results that you want from the BBL portion of the procedure. So that part doesn't make any sense. All right, what about globally? So globally, so you're like, well, what if I go to Dominican Republic? What if I go to Colombia? What if I go to California? All right, I still don't recommend it. Okay, why? When you combine, Lipo 360, BBL, tummy tuck, and the breast dog, that is a lot of procedures. Every time you throw something on there, you're increasing your complication rates. Okay, so the complication rates of for needing a blood transfusion, blood loss, and then needing a blood transfusion go way up, and your complication rates in terms of blood clots goes way up as well, which can be dangerous. Either one of those potentially can be fatal. Okay, it's just not worth it. Then you have to recover from the huge surgery. And how are you going to recover, right? Well, ideally for a BBL, you're not putting pressure on the buttock and hips. So we ask those patients to sleep face down. But if you have a breast dog and a tummy tuck, you absolutely cannot be sleeping face down, right? You have to be sleeping face up, okay? So now your results for the BBL portion are going to suffer, right? Because you're putting pressure on the buttock and the hips. Yes, you can try cutouts, you can use zero gravity chairs, this and that, but it's not the most ideal environment for recovery for the BBL procedure. Therefore, the BBL procedure portion of it will suffer. And again, you're not going to be getting the best result there. You're going to be compromising the results of one surgery or the other. So my recommendation is to separate out those procedures. If you really want the best long-term results, and at the end of the day, that's what it's all about, right? You're investing in yourself. You're investing in your body. You're putting in all your hard-earned money into something that you really want to last for a long time, right? And to try to get the best result out of it. I recommend separating out the procedures. I always recommend the tummy tuck portion of it first. So I would do the mommy makeover first, right? That's going to involve your tummy tuck and your breast surgery, and then come back 3 to 4 months later and do your Lipo 360 and fat transfer, right? Your BBL.
Okay. Can you get a tummy tuck with a BMI of 31?
Yeah, you certainly can. You can get a tummy tuck with a BMI of 31. Now, my preference, my max BMI is 30. So ideally, you would lose just a little bit of weight to get to that BMI of 30. And really, depending on your height, it's usually not a lot. You may have to lose, say, 5 pounds, or it really depends on your height, but it's not going to be a lot of weight that you have to lose to get to that BMI of 30. So can you do it? Yes, there are surgeons, even here at Pure, for example, Dr. Riddell, Dr. Wigriff, they'll accept a little bit of a higher BMI, and you'll be able to get your tummy tucked. So the short answer is, can you do it? Yes. Ideally, you will get your BMI just a touch lower.
Okay. How do you handle patients with anxiety to meds? What do you suggest for pain?
Patients with anxiety?
Anxiety for meds, for the medicine.
Anxiety for meds, interesting. All right, so let me just break it down. Like, how do we deal with pain post-op, right? So first of all, the expectation cannot be that you're going to have zero pain, right? If you're having surgery, there's going to be some degree of pain. So the point there is to control the pain, but we won't be able to eliminate the pain, okay? So you can't expect zero pain. All right, so how do we eliminate the pain? Well, of course, during the time of surgery, you're going to have an IV, and we're going to give you pain medication through the IV. And that's going to be in the form typically of narcotics, and one of them is very strong, which is fentanyl, okay? And that's okay while you're under general anesthesia because, we're doing the breathing for you, right? So don't worry about that. Now, once you come to our recovery room, you'll still have your IV and we'll give you pain medication there as well through the IV. But once you leave our recovery room, then you're going to have oral pain medication. And the one we typically prescribe is Percocet, which is a combination of oxycodone, which is a narcotic, and Tylenol. Comes together in what's called Percocet, okay? That you're going to use as needed. Most of our patients typically use that for the first 24 to 48 hours, okay? But as soon as you can, as soon as you're feeling a bit better, then I do recommend trying to switch out from that Percocet and going to what's called an NSAID, a non-steroidal such as ibuprofen. You can't start the ibuprofen within the first 48 hours, but certainly after 48 hours, you can start your ibuprofen. And I recommend anywhere from 600 to 800 milligrams of ibuprofen every 6 hours. That's going to help you both with your pain control and it's going to help reduce inflammation. Okay? So that is my recommendation. If you're anxious about certain pain meds or you don't want to take narcotics, there are other alternatives. to the narcotic, so we can work with you there as well. For example, tramadol is a non-narcotic that we can prescribe instead of the Percocet.
How long is a BBL and a breast augmentation procedure?
So again, like I just answered before, I probably wouldn't do that at the same time unless you're fairly thin, and therefore the 1,000 cc is going to make a difference for you. My typical BBL procedure is somewhere around 2 hours or so, 2 to 2.5 hours. But it really depends a lot on the patient and if there are any add-ons and things of that nature, right? So if you're like a lower BMI patient, say, under a BMI of 25, and you're just having a straight liposculpture with fat transfer, nothing else, then it's going to be about 2 hours, right? But say, for example, you're a higher BMI patient, your BMI is now 28, and you decided to add the vaser, and then you also decided to add the arms, and you wanted to add body type to the arms and face type to the chin, right? So now that surgery is going to get longer, right? So it really depends on the patient and exactly what they're getting. Breast augmentation, like I said, is a lot more predictable. Breast augmentation in my hands is under 30 minutes. Quick. Yeah, so less than 30 minutes for a breast augmentation. Now, that's for me, and I'm very efficient. There's other surgeons there that take a lot longer for their BBLs and a lot longer for their breast augs. And I think it has a lot to do, of course, with skill and experience.
Okay, talking about the time. So for the tummy tuck, I'm gonna pick that question right now.
Yeah, tummy tuck is pretty reliably about an hour and a half. So again, fairly quick for us here at Pure. But like I said, I have a lot of experience with these surgeries. There is a certain skill set as well, and so we tend to be very efficient. It has always been a focus of mine because I want to have my patients under general anesthesia for the shortest time possible. Okay, why is that? Because there have been studies that have shown that the longer you're under general anesthesia, then the higher the potential issues in terms of blood clots and things like that. That typically doesn't kick in until you're over 5 hours or so. So the recommendation by the American Society of Plastic Surgeons is that for purely elective procedures that we're doing in the office-based surgery setting, they really should not exceed 5 hours. All right, and I keep most of my procedures down to about 3 hours or so.
Let's go back to TikTok. What surgery would you suggest after 2 C-sections and weight loss surgery?
Yeah, so typically if you've had a couple C-sections and you've had weight loss, for most patients that means that you're going to have abdominal muscle separation and abdominal muscle weakness, okay, and excess skin. So typically the best surgery, at least for the abdominal region, is going to be a tummy tuck because it can address all those things. It can remove the excess skin. It can bring the rectus abdominis muscles, which are the abdominal muscles through here, bring those back together again. It can strengthen your abdominal wall. Okay, and we can do some lipo along the flanks and the waist to already start bringing out more of that curvy figure. And then plus minus, what's needed for the breast. A lot of times, of course, after pregnancy, after breastfeeding, and weight loss, the breasts tend to become more droopy and they tend to lose volume. In which case, then typically what's recommended for that is a breast lift with implant.
For someone traveling from other states, how long do you recommend we stay before traveling back?
So the minimum stay is 5 days post-op. Okay, not 5 days total, right? 5 days, you need to be here 5 days post-surgery, okay, post-op. So what does that translate to? It usually means you're here for a week, right? Because like I see all my patients day before surgery. So I'm going to see you the day before surgery, and then you have surgery day, and then you have 5 days. So it's usually about 7 days here altogether.
Okay. How long after BBL can you sit down without the BBL pillow?
So yeah, in order to sit down directly, meaning putting direct pressure on the buttock, no BBL pillow, you have to wait 6 weeks. 6 weeks for that.
Is true that the arm and thigh fat doesn't survive? You recommend adding more or just the 360 lipo for a BBL?
So the first part of the question, no, I don't think that's true. Fat is fat, right? I don't see why the arm fat or the thigh fat wouldn't be able to live. It's, it's living in your arm. It could live as a fat transfer as well. So I don't agree with that. I think we can get fat from the arms and the thighs and use that for transfer. Now, in terms of my recommendations, this is going to depend on the patient and what their goals are and how much fat we need, right? So again, if for most patients, typically we target additional areas if they want those areas to be targeted. And yes, the most common ones that we do in addition are the arms, the chin, and the inner thighs. But if you have no problems, say for example with your inner thighs, then there's no need to add that. Now, if you're a lower BMI patient and we need to just try to grab fat from anywhere that we can, then we start going to other areas. Yeah, we'll do of course the lipo 360 all across the trunk, and then we can we'll maybe get a little bit more fat from the thighs, a little bit more fat from the arms. The chin, honestly, in terms of purpose of just getting more fat doesn't contribute much at all. So the chin I only do if you actually want to focus on the area and try to make it better. But in terms of additional areas we can go to get more fat for transfer, the most common would be the arms and the inner thighs.
Okay.
There's one more area that I wanted to talk about since we're on that subject, which is like nearly impossible to get rid of with exercise and diet. And I know a lot of women hate it, but it's that little chunky right here. I know, and I've seen it. I even seen it on like thin women. They'll have that extra chunk right there. They hate it because they're wearing a nice swimsuit and it kind of pops out. And I'll tell you right now, you can try to work it off. You can try to diet, lose weight, and a lot of times it doesn't go away. So the best way to reduce that area is with liposuction. And so we call that the subaxillary area, and that is another area that you can add on to your lipo 360 or BBL.
What surgery do you do the most?
BBL, that's right. So I'm what you probably recognize as a BBL expert, okay? More specifically, I am an expert in ultrasound guided liposculpture or fat transfer, or ultrasound guided BBL, okay? I've probably done more ultrasound guided BBLs than anyone in the US. Okay, I've done over 2,000 of them since September of 2019. Okay, and basically I'm one of the pioneers in this technique, and due to our experience and our safety record, this has been, I've been in front of the Florida Department of Health, advocating for its use, and partly due to that, it is now mandatory in the law in Florida that all BBLs have to be done under ultrasound guidance, and it's something that we're very, very proud of because it increased the safety profile of this procedure. So all those horror stories that you've heard from BBLs in the past should be in the past, okay? That number that people throw out there like, oh no, the mortality of the BBL is 1 in 3,000, that is now no longer true. That was true in 2017, okay? We're significantly past that now. So if you're going to someone who has a lot of experience, if you're going to someone who is using ultrasound guidance, okay, the mortality rate is going to be much, much lower, probably somewhere in the range of 1 in 25,000 to 1 in 50,000, okay? Just to put that in perspective, the mortality rate for a tummy tuck is approximately 1 in 15,000, okay? So a BBL done by someone who has experience and uses ultrasound guidance is at the very least just as safe as doing a tummy tuck, or potentially even safer.
Do you recommend a round 2 if with your first BBL the majority of the cells die?
Yeah, I mean, if you had your round 1, right, and you lost a significant amount of fat, and this is going to depend, on the patient, right? So some patients lose a little bit more fat than others. I would say that for me in my practice, the average fat loss is about 30%. Okay, but say for example, say unfortunately you're one of these patients where you lost more, you lost 50%. Well, then yeah, I mean in that case, I would recommend to come back for the round 2 so that we can keep building upon that foundation. Okay, think of it like Legos or building blocks. All right. You very rarely, even though you may sometimes feel that way, you would very rarely lose all the fat. Extremely rare to lose 100%. Extremely rare. okay? So you're gonna have some fat that was able to take, and that's gonna build like the bottom, starting to build the first building blocks of your foundation, right? And then you come back for your round two. We're not starting all over again, but we're building on top of that foundation that we have already set, okay? So I do recommend coming back for round two if you need to add more fat to certain areas to achieve the look that you're going for.
Okay. Why are the patients not wearing a faja right after their BBL?
Great question, because it is something that has evolved or changed for me in our practice, right? So as you know, I'm continuously looking for ways to make things, better, more efficient, safer for our patients, right? Continuously learning through various methods, okay? And one thing that has changed from say, 3 or 4 years ago is that now my patients after liposculpture 360 or liposculpture with BBL, you don't leave the facility with your faja on, okay? And you're gonna be putting on your faja for the first time the next day, typically after your first massage. Why is that? Because I found that many times in the past, we would sometimes put the faja on, and then the patients, some patients would really, really, swell up. They get very, very swollen, okay? And then this was leading to skin issues, what some people call faja burns or lipo burns, okay? And so that, was becoming a problem with certain patients. And so I wanted to just avoid this issue altogether. So now you don't put your faja on. We actually we're gonna examine you, or the team is gonna examine you the next day after surgery. We're gonna ask for your photos, we're gonna ask for video, we're gonna take a look at the skin all the way around and make sure that the skin is looking okay. And if everything looks good, well then you can proceed and have your faja. But if there's any area of the skin where it might look a little bit questionable, then we keep you out of the faja. Sometimes we send you some additional medications, which can be oral or a cream, in order to help that skin along and help it, basically recover from the trauma of surgery, if you will. And then once everything's looking good, then you can, start with your faja and your foams.
Nos vamos al español.
Dale.
Doctor, esta misma persona pregunta si usted habla español primero.
Sí.
Y luego dice, doctor,
hablamos español.
La primera consulta tiene algún costo. Estoy interesada en un recambio de implantes mamarios.
Excelente, excelente. Bueno, y gracias por la pregunta. Bueno, número uno, sí, hablamos español. Es más, yo soy bilingüe, todos los cirujanos de Pure son bilingües, todo el staff de Pure es bilingüe, ¿ok? So, todos aquí hablamos inglés y español, ¿ok? Bueno, en términos de consultas, hay 3 niveles de consultas que tenemos aquí en Pure. El primer nivel es la consulta virtual. Esa es la que vas a ir al website, que lo tengo aquí escrito, el www.pureplasticsurgery.com, y vas a ver el botoncito donde dice Virtual Consult, ok, consulta virtual, y ahí vas a ir al cuestionario, lo vas a llenar, vas a poner toda tu información y mandar tus fotos, ok. Este tipo de consulta es completamente gratuita, ok, el costo es 0. Ahí yo puedo recibir la información, ver tus fotos y darte las recomendaciones. ¿Ok? Y después de que yo tenga mis recomendaciones, te va a llamar una coordinadora y va a coordinar todo contigo. ¿Ok? Bueno, esa es la primera. La segunda manera de hacer una consulta es lo que le decimos la consulta de video. Video consult. ¿Ok? Después de que hables con una coordinadora, ella te puede agendar una consulta de video. En ese momento, pues sí, es un tiempo en cual tú y yo conversamos a través del video, y como tenemos varios pacientes que son fuera del estado, eso es muy, muy conveniente. ¿Ok? Y ahí, bueno, puedo contestar todas las preguntas, puedo dar mis recomendaciones, etcétera, etcétera. ¿Ok? Este sí tiene un costo de $250. Y por último, se puede hacer la consulta presencial, o sea, la consulta en persona aquí en Pure Plastic Surgery, ¿ok? Y esa consulta también se puede agendar, pero tiene un costo de $500. Ahora, van a decir, oh, wow, doctor, $500 y $250. Ok, lo que tienen que saber es que este dinero, cuando hagan el booking, este dinero va a ir hacia su cirugía, ¿ok? O sea que no es adicional al costo de la cirugía. Okay? All right.
Okay, what advice do you have for a patient who's nervous about going under general anesthesia for a mommy makeover?
Right. So we do most of our surgeries here pure under general anesthesia. Okay. And first of all, what I can tell you is that it's extremely safe. Okay. We use very well versed, very experienced nurse anesthetists. Okay. And they've been with us for several years now. Okay. So they do an excellent job. It's very, very safe. And what I can tell you is that in some circumstances, I think it's even safer than doing things, at least certain things, under local. Okay? So, for example, a big liposuction case or lipo 360 or something like that, right? When you're trying to do a lipo 360 under local, that means that you have to numb up the patient. And how do you do that? Well, you're adding something called lidocaine to the tumescent fluid, or the fluid that you instill in order to be able to do a procedure under local, right? So this lidocaine is not completely benign. There is something that's called lidocaine toxicity. So if you overdo with the lidocaine, then the body cannot handle it, it can't metabolize it, and it becomes toxic to the body and can affect the nervous system, leading to seizures, or it can affect the cardiac system, leading to arrhythmias or basically a heart attack. Okay? So when you do it under general anesthesia, there's no need for lidocaine, so that risk is completely eliminated. Okay? The other risk is that what if you're doing it under local and of course the patient inadvertently moves, right? Well, you don't want, you have this long cannula that you're putting inside the patient in order to do the liposuction or the fat transfer. You can't have any movement whatsoever. So any sort of movement can lead, can be potentially more dangerous as well. All right. So having said that, I think, what we can do to decrease anxiety is, first of all, know that it's extremely safe, that our anesthetists are very, very experienced, that they've been with us for a very long time, and that I've trusted them with my very own family and my very own staff.
Okay, is Vaser mandatory?
Yes. So that is something relatively new, started this year, January 2024. And I basically included it with all of my lipo 360 and BBL surgeries. Okay. Why did I want to not make it like elective? Because you make it elective, then people are going to start like not wanting it, and then there's that's going to lead to suboptimal results. So the Vaser is very, very beneficial because it helps release or emulsify the fat from the surrounding tissues, and that allows me to remove more fat with less blood loss, less inflammation, and the Vaser helps with skin retraction. So these are all positives. So I definitely highly recommend it for any liposuction case, and it's become basically part of the package that you get when you have surgery with me here at Pure Plastic Surgery. Okay. Now the question that we get a lot, and it is a valid question because it used to be true, or it can be true if the surgeon doesn't really know exactly how to set the Vaser for what they're doing, is that patients ask, well, what happens with the fat with the Vaser? Does it melt the fat away? Does it decrease the viability of the fat? Is there less fat survival, right? So with the old Vaser machines, the ones that you couldn't dial in as much, that was more true, okay, because they were more intense. There was a higher intensity, and so there was more of a tendency to melt the fat away, which is why I didn't use Vaser 3, 4, 5 years ago. Okay, but now we have the newest generation of the Vaser machine, and we know what are the specific settings for fat transfer. So when you're doing fat transfer, when you do liposuction with the purposes of then doing fat transfer, you're going to adjust the settings of the Vaser to those that maintain the viability or the life of the fat cells. All right, and that's what we do here. So do not worry about more fat cells dying or any of those issues, because we have the most up-to-date machine with the most up-to-date settings.
Okay, and just like a wrap, how to make the consultation, but in English, Doc, porque la dijo en español y quieren
Sí.
saber, ya.
Okay.
A quick recap.
So yes, so anyone you're looking to get more information, get in contact with our coordinators, or just go ahead and get a quote and book a surgery. The easiest way to do that is to go to the website. So go to www.pureplasticsurgery.com. You're going to go to the virtual consultation button. That's going to take you to a questionnaire. You fill out that questionnaire. And you upload your photos. That's going to come to us. I'll be able to verify the information, look at the photos, make my recommendations, and then you're going to get a call from one of our very skilled and very knowledgeable coordinators, okay? And they're going to spend some time with you. They're going to ask all about your goals, your expectations. They're going to answer all your questions, and then they'll be able to, of course, provide you a quote and book your surgery, all right? And that's the easiest, most efficient way of doing it. That's what we call the virtual consult. However, if you want to, speak with me, there's also the availability of a video consult for our out-of-town patients. We can do it through video. Or, of course, you can always come here to Pure and have an in-house or in-person consult, okay? Now, the virtual consult is free. Okay, the video consult is $250 and the in-person consult is $500. Okay, but these fees go towards your surgery, right? So if you end up booking, then these fees will go towards the price of the surgery. It's not in addition to that. Okay, all right. Okay, everybody, was that 30 minutes already?
32 minutes, 3 seconds.
Oh boy, all right. So 32 minutes answering all your questions, which was great. So that was great fun. I'm glad we kicked it old school here today. But next week we'll have a topic to discuss, and then of course we'll answer more of your questions, okay? All right, everybody. So I look forward to seeing you all next Wednesday on Hump Day with Dr. Alex Earle. Take care. Ciao.